Okay, I'm looking here at the hip joint and want to take a look at both of the major articulations of the lower limb. So that's going to be the hip and the knee over here. So looking at the hip to orient ourselves, we can see that we're looking at the front of the hip. This is the ilium. Here, I'll use the pointer. This is the ilium up top. This is the anterior surface of the ilium. We have the pubis here, the pubic symphysis, and at the back we have the ischium. You can tell this is the ischium. We can see the ischial spine back here at the back. If we look specifically at the hip joint, so now that we've oriented ourselves to the three bones of the os coxa, we can tell our ligaments connect bone to bone. And so the ligament that is going to connect the ilium and the femur together is the iliofemoral ligament. And we can see there are kind of two branches of the iliofemoral ligament. There's this one here connecting the ilium and the femur, and then one just behind it, also part of the iliofemoral ligament right here. So those are both the iliofemoral ligament. If we come forward a little bit, right, this is the pubis. So this is our pubofemoral ligament right here. It's going to be there. And to find our ischiofemoral ligament, it's not surprising that we need to look at the posterior surface. So now we're looking at the back of the hip joint. And this is the ischium, the ischial spine. So this is our ischiofemoral ligament here. So looking at the posterior surface, we can also see this connective tissue band that's going to wrap around the acetabulum, which is the recess in the os coxa into which the head of the femur fits. And that connective tissue band that we see there is the acetabular labrum. So this is the acetabular labrum right here. And if we swing it around, if we swing the articulation around such that, again, we're looking at the anterior surface of the hip, we can see that around the neck of the femur, there's another connective tissue band. This is the zona orbicularis. So this is the zona orbicularis that we see around the femur. And then up here, this is the acetabular labrum. All right, one other ligament in here. We have a cutaway in here so that we can see the top of the femur. So the bone that we see back here, that's the head of the femur. And remember that capitulum that we saw at the top there, that connects to a ligament called the ligamentum teres that helps to hold the head of the femur in place in the acetabulum. So those are all of our structures that we need to know on the hip. And so now we can come over here to the knee. So we're looking again at the anterior surface of the knee. We can tell that this is medial and this is lateral because we have the fibula over here and we have the tibia over here, and the fibula will always be lateral. So some of our other structures, we know the patella, which is the kneecap, is in there. And if I kind of pull that back, we can see the kneecap in there, and we know ligaments connect bone to bone, tendons connect muscle to bone, and so where we see the bone of the patella, everything inferior to that here is going to be the patellar ligament down here connecting bone, the bone of the patella to the bone of the tibia. So this is the patellar ligament. Everything superior to that is going to connect the patella to the quadriceps muscles, a group of 4 muscles that are up here. And so this is called the quadriceps tendon up above the patella, where it goes to that quadriceps muscle group. All right, some other ligaments that we see here connect the tibia down here to the distal end of the femur. And we have one on one side of the knee joint and one on the other. These are our collateral ligaments because they're on the outside, right? The collateral damage is the damage that happens outside of the main accident. So these are our collateral ligaments. They're on the outside of the joint capsule. And on this side, this is the medial side, so we can call this the medial collateral ligament. It is also called the tibial collateral ligament because it connects that femur bone to the tibia down here. So tibial collateral ligament or medial collateral ligament. And on the outside over here, we have the lateral collateral ligament or the fibular collateral ligament because it connects the femur to to the fibula down here. Also, from the front, we can see the menisci. So a meniscus is a fibrocartilaginous disc, and it creates this sort of cup shape along the proximal end of the tibia, into which the condyles, the femoral condyles, can articulate. And so this is named just for its location, either medial or lateral. This is our medial meniscus. Is going to be on the medial side by the medial collateral or tibial collateral ligament, and on the opposite side we have the lateral meniscus, which is going to be on the side by the lateral collateral ligament or the fibular collateral ligament. Okay, so we need to turn this guy around to the posterior. Now we're looking at the posterior surface of the knee to identify our other ligaments. So also in the knee here we have cruciate ligaments. These are intracapsular ligaments, meaning that they run inside the knee capsule. And we can see our posterior cruciate ligament back here. So it is posterior. It's going to attach to the posterior side of the proximal tibia here. And so this is our posterior cruciate ligament. Our anterior cruciate ligament, or ACL, is the one that we see connecting up here at the top of the femur. If we were to kind of open this up, it's a little bit of a tough job, but if we were to open that up, we would see that it connects to the anterior part of the proximal tibia, and thus it gets its name, the anterior cruciate ligament. So posterior cruciate ligament, anterior cruciate ligament. And then another ligament that is sometimes missed in textbooks here is the posterior meniscofemoral ligament. So a lot of words there, but posterior, we know we're on the posterior part of the knee. This is going to connect the meniscus, right, this lateral meniscus, with the femur. So it is the posterior meniscofemoral ligament. Once again, the posterior meniscofemoral ligament. And those are all of our structures of the knee.